me take a moment to welcome everyone here. What we hope is the beginning of another bright day in legislative effort. In fact, this is, I think, State of Utah. As I mentioned on the floor, one of the things that we started this path with is that we would have a mission statement. And our mission is and remains that to maintain and enhance the quality of health care for every Utah. And that includes every economic and social level within the state of Utah. I think that today makes a measured step in improving that process. I started out with healthcare by the numbers. Last year was 13610. This year it's year 2, so it's 2. We're still on our path that we started out with, kind of the outline of the official 3 years. The 6 major items this year is going to morph probably into 20. We're taking a very energetic and aggressive step forward as we try to improve what we think is a health system that, by comparison to others around the country, is a very quality health system. We have, by comparison, and I want to extend my thanks to all of those involved in the healthcare system, from the insurer to the hospital to the provider, all the way down to the insurance company, the complete gamut of this. But we have a trajectory that is unsustainable. We have to find better solutions. And for Utah, whose system appears to be the best of all of the ones that are challenged, we're in a very good position, hopefully, to make a point and maybe lead the nation in this effort. I'd like to excuse Senator Kilpack right now. He's involved in some items that couldn't attend with us, but I'd like to express my sincere appreciation and recognize the working groups. We have a task force that spent literally hundreds of hours involved in this, but the key building and the components that helped us this past year is relying on those folks that are literally on the ground, in the hospitals, in the doctor's offices, in the insurance industry, in the businesses that are paying for this, and for the community effort and the community working group. Those 5 particular working groups had a critical part in, and will as we go forward, and are key stakeholders. So I'd like to thank both the hospitals, the Utah Medical Association, and the healthcare providers, the United Way, and I want to extend, and to the Utah Health Policy, excuse me, I knew that was wrong. Utah Health Policy Group for their efforts. And in fact, just a little shout out. The ability that they took and made the next step so that using some of the teleconferences techniques that we have throughout the state, and inviting, I mean, I'm sitting in St. George and I'm interacting with people 300 and 400 miles away, and not in the capital, but in different communities, of engaging them in the community, I think was outstanding, and I want to give them some recognition for that. And for the United Way, we needed to have a very good partner in this process when it comes to outreach into what we would call the community. It's a wide group. That's probably the most diverse of all of the groups here, but have their help and effort. Very much appreciate that. The insurance industry, thank you. We've had an interesting summer. Well, I won't say what I was going to say, but we've had an interesting summer. It's been a spirited summer, and appreciate particularly the last 60 to 90 days where there's been a cooperative effort of rolling up sleeves, and a much of the work that's taken place in getting us to this point in what I think is year 2 of a 10-year process is very, very critical. And I would be remiss if I didn't express my appreciation to the business community. What's important here, you need to understand that 80 cents out of every dollar spent on health care in the state of Utah comes from the business community. They must be an engaged part of this process, or I think we're going to find ourselves at a finish line that we would not like to have. So I very much express my appreciation to them.
We feel like our goal is to have more businesses covering their employees than we have today, and we think that what has been passed in these bills, the opportunities that they provide, is that more employers are likely to keep their health insurance for their employees. So we're hoping that we have an increase, not a decrease any further than where we're at today, so that would certainly be the #1 goal. We have people that care a great deal about their employees, and Utah traditionally has a great need. We just feel like that this is a wonderful opportunity. If I may just say one other thing, that I think when Speaker Clark addressed, you know what's different about here and anywhere else in the country? Do you know what's really different? Is everybody's at the table. The fact that you have an insurance industry who actually care about health insurance, that you have hospitals that have a need for reducing costs. We have doctors that are concerned about providing. The uniqueness that Utah has is under the leadership that the legislature and many of those that are here has brought everybody together. That's what's unique, and that's why it's going to work.